International Health Mastery, Chapter 2, Global Efforts for Eradication of Diseases. The only human disease which has been eradicated from the globe is smallpox. It was effectively eradicated with concerted efforts of the international community, including the WHO, the individual countries, and the global healthcare workers using an effective vaccination. The needle on the right was most effective in giving the vaccine with the proper puncture wounds. Reasons why global eradication of smallpox was achieved. Let us watch a video.
10,000 years ago, a deadly virus arose in northeastern Africa. The virus spread through the air, attacking the skin cells, bone marrow, spleen, and lymph nodes of its victims. The unlucky infected developed fevers, vomiting, and rashes. 30% of infected people died during the second week of infection. Survivors bore scars and scabs for the rest of their lives. Smallpox had arrived. In 1350 BC, the first smallpox epidemics hit during the Egypt-Hittite War. Egyptian prisoners spread smallpox to the Hittites, which killed their king and devastated his civilization. Insidiously, smallpox made its way around the world via Egyptian merchants, then through the Arab world with the Crusades, and all the way to the Americas with the Spanish and Portuguese conquests. Since then, it has killed billions of people, with an estimated 300 to 500 million people killed in the 20th century alone. But smallpox is not unbeatable. In fact, the fall of smallpox started long before modern medicine. It began all the way back in 1022 AD. According to a small book called The Correct Treatment of Smallpox, a Buddhist nun living in a famous mountain named Ome Shan in the southern province of Sichuan would grind up smallpox scabs and blow the powder into nostrils of healthy people. She did this after noticing that those who managed to survive smallpox never got it again, and her odd treatment worked. The procedure, called variolation, slowly evolved, and by the 1700s, doctors were taking material from sores and putting them into healthy people through 4 or 5 scratches on the arm. This worked pretty well, as inoculated people would not get reinfected, but it wasn't foolproof. Up to 3% of people would still die after being exposed to the pus. It wasn't until English physician Edward Jenner noticed something interesting about dairymaids that we got our modern solution. At age 13, while Jenner was apprenticed to a country surgeon and apothecary in Sodbury, near Bristol, he heard a dairymaid say, "I shall never have smallpox, for I have had cowpox. I shall never have an ugly pockmarked face." Cowpox is a skin disease that resembles smallpox and infects cows. Later on, as a physician, he realized that she was right. Women who got cowpox didn't develop the deadly smallpox. Smallpox and cowpox viruses are from the same family, but when a virus infects an unfamiliar host, in this case cowpox infecting a human, it is less virulent. So Jenner decided to test whether the cowpox virus could be used to protect against smallpox. In May 1796, Jenner found a young dairymaid, Sarah Nelms, who had fresh cowpox lesions on her hand and arm, caught from the udders of a cow named Blossom. Using matter from her pustules, he inoculated James Phipps, the 8-year-old son of his gardener. After a few days of fever and discomfort, the boy seemed to recover. 2 months later, Jenner inoculated the boy again, this time with matter from a fresh smallpox lesion. No disease developed, and Jenner concluded that protection was complete. His plan had worked. Jenner later used the cowpox virus in several other people and challenged them repeatedly with smallpox, proving that they were immune to the disease. With this procedure, Jenner invented the smallpox vaccination. Unlike variolation, which used actual smallpox virus to try to protect people, vaccination used the far less dangerous cowpox virus. The medical establishment, cautious then as now, deliberated at length over his findings before accepting them. But eventually, vaccination was gradually accepted, and variolation became prohibited in England in 1840. After large vaccination campaigns throughout the 19th and 20th centuries, the World Health Organization certified smallpox's eradication in 1979. Jenner is forever remembered as the father of immunology. But let's not forget the Dairy Maid Sarah Nelms, Blossom the cow, and James Phipps, all heroes in this great adventure of vaccination, who helped eradicate smallpox.
The global smallpox eradication happened in North America in 1952, in South America 1971, in Europe in 1953, in most of Asia in 1975, in Africa 1977, Somalia October 12, 1977 was the last case of the vaccine associated case of smallpox. But the last known case of variola major, which is the true case of smallpox, was in Bangladesh, October 16, 1975. The 3-year-old Rahima Banu, who is the last known person to have had naturally acquired smallpox in the world, in Bangladesh. Her case was reported to the local smallpox program team by 8-year-old Bilkis Unesa, who was paid 250 taka reward for her diligence. Poliomyelitis. It is caused by an RNA virus which leads to flaccid paralysis or even death when it affects the respiratory muscles. Prevention is the only management. There are 2 vaccines available. Children treated with respiratory paralysis in iron lungs is seen here, where you see the child with the head outside the cylindrical iron lung, and the iron lung generates a negative pressure, moving the thoracic muscles outward, thus mimicking respiration. And this was very prevalent during the times of poliomyelitis. Let's watch a video on the 2 polio vaccinations.
Polio is a disease that causes permanent paralysis. We can't cure it, but we can prevent it. 2 important tools help to prevent polio, 2 safe, effective vaccines. One of these vaccines is given with just 2 drops into the mouth of a child. This is called the oral polio vaccine. The other is given with an injection. This is called the inactivated poliovirus vaccine. They both teach children's bodies how to fight off the poliovirus, but they do this in different ways. The oral polio vaccine builds protection in the child's intestine. This vaccine not only protects the child who receives it, but also protects others around the vaccinated child. Several doses of the oral polio vaccine should be given to every single child in places where polio is a threat. The injectable vaccine builds protection in the blood instead of the gut. It helps to boost immunity and keeps countries free from polio. But it doesn't stop polio spreading between children, so it is not as useful in places where the virus is still circulating. We need the oral vaccine to stop the virus wherever it is found. Once polio has been stopped everywhere, the inactivated poliovirus vaccine will be used on its own to keep populations protected. Both of these vaccines have been approved as safe and effective by the World Health Organization. To do their job properly, they need to be given to all children, no matter where they live. Thanks to these vaccines, cases of polio have fallen by over 99% around the world. Let's vaccinate every last child. Let's end polio forever.
Now, there are multiple challenges with the oral polio vaccine. Since it's a live attenuated virus, the oral polio vaccine's greatest challenge has been to maintain the cold chain, which has been overcome with coordinated global grassroots education and health efforts, as seen here with a cold pack carried by a community health worker. The world embarked on a mission for global eradication in 1988. There are three strains of wild type virus which are placed in the two types of vaccines. A live attenuated or OPV used in more than 100 or so low and middle income countries, an inactivated poliovirus vaccine in developed nations. In 2000, there was an outbreak caused by a virus resulting from the genetic reversion of one of the vaccine viruses, which was called a circulating vaccine derived poliovirus or CVDPV. The Global Polio Eradication Initiative intensified. Wild type poliovirus type 2 from OPV was dropped in April 2016. A robust international surveillance for both the wild and the vaccine derived virus is being undertaken. The surveillance for polio flaccid paralysis and stool sample monitoring will continue in countries which are declared as polio free. Even after withdrawal of vaccine, the surveillance for polio vaccine paralysis and stool sample monitoring, which is being continued. Recently, in 2018, in India, there was a detection of wild type OPV type 2 strain in stool samples from children given vaccine by a private manufacturer, which has led to a lot of furor in the scientific community. Eradication of polio from world, the current status. As you can see here, 90% of the world is polio free. There are few countries which are at a risk, a few where there have been outbreaks. The countries such as Pakistan, Afghanistan, and Niger, which are endemic. India was declared polio free since March 2014. It started its polio eradication program in 1995, when more than 50,000 children were crippled by polio. There are 2.3 million polio workers and volunteers with their relentless efforts have helped to achieve this in India. Global efforts for disease eradication, why and how it is important. Let us watch a video.